April is Autism Month. It's tips time. Welcome to Training Intervention Program for Behavior Change, Tips for Behavior Change. I'm your psychologist and behavior specialist, Geraldine Goud. Please remember to subscribe, like, share, and click that notification bell. Today we're going to be talking about autism spectrum disorder and how you can identify if your child may be displaying characteristics or features of autism spectrum disorder and how one receive a diagnosis of having autism spectrum disorder. So, autism spectrum disorder is persistent deficits in social communication and social interaction across multiple contexts as manifested by the following currently or by history. Deficits in social emotional reciprocity, deficits in nonverbal communication behaviors used for social interaction, deficits in developing, maintaining, and understanding relationships. Then we move to restrictive, repetitive patterns of behavior, interests or activities as manifested by at least two of the following currently or by history. Stereotyped or repetitive motor movements, use of objects or speech, insistence on sameness, inflexibility, adherence to routines or ritualized problems, or patterns of verbal or non-verbal behaviors, highly restricted fixated interests that are abnormal in intensity or focus, hyper or hyperactivity to sensory input or unusual interest in sensory aspects of the environment. These are the DSM criteria that is used for a child to be diagnosed with having autism spectrum disorder. So, what are the behavioral features or the behavioral characteristics of autism spectrum disorder? First, we have reciprocal social interaction deficits. This is where the child averts or is not direct in their eye contact. So there is averted or indirect eye contact. The child is unable to make eye contact with a caregiver, an educator, or a parent. So they do not engage in eye contact. Then they have minimal facial expression and use of gestures. So they generally have what we call a flat affect. You can't use their face to identify any emotional feeling that they may be having because they just have a flat affect. There is no expression in their faces. Then there is a lack of joint attention and focus on others. Again, if you're trying to have a conversation with them, there is no joint attention. They are not paying attention to you. They are not focusing on you. And then there is egocentric, verbal, and social interactions. So I want to move on now to communication impairments. And for communication impairments, we have what we call developmental apraxia of speech. This is an uncommon speech disorder where the child will have difficulty making the correct movement when speaking. So they can't match their speech with their movements, and that is caused within the brain, right? And then we have echolalia. Echolalia is when the child say what you say, just continue to echo what you have said. So if you were speaking and you use the word ball in a sentence, the child will continue to say ball, 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 ball. That is what we call echolalia. And then we have what we call monotone robotic vocal prosody. What is that? The child speak in a monotone robotic way. So they will say, I want water. I want water. I want water, as if they are a robot. And so they will speak like that. And then of course there's deficit in concrete language acquisition and interpretation. They are not able to acquire language. It's very difficult for them to acquire language and interpret language. So we move on to restricted repetitive patterns of behavior. This is when there is self-stimulatory movements. And some of these self-stimulatory movements are like rocking, nodding the head, and even biting the nails. And then they become fascinated, or they engage in what we call fascination with a particular object or item, right? And what happens is that because they are fascinated by this item, they become obsessive and preoccupied and attached to the item or the object. And then there is reliance on routines and rituals. Children with autism rely heavily on routines. And if you interrupt their routines, they will engage in aggressive behavior, or a few might withdraw. So they really like to work with instructor. Structure is important to facilitate a child diagnosed with autism spectrum disorder. And please be reminded that it is a spectrum disorder because the spectrum move from mild to severe. So the child can have autism spectrum disorder mild, autism spectrum disorder moderate, or autism spectrum disorder severe. So they like their routines and they like structure. And if you take them out of their routine, you put them at risk to display or to engage in aggressive behaviors. And so I want to move on to sensory differences, because children with autism are highly sensory stimulated. So you will have what we call a hyper, which is over, and hypo, which is under responsiveness to sensory stimuli. They will have tactile defensiveness, which is severe sensitivity to being touched. So if the caregiver tries to touch them or hug them, they are very defensive. They do not want to be touched. They do not want to be touched any at all. And so sometimes this can be difficult for a parent or a guardian, because they may want to show the child some sort of care by hugging and touching, and it is aversive for the child. They do not want to be touched. Then there is what we call hyperacusis, which is when daily sounds seem louder than normal. So if they are watching the television, and even if you put it at a normal range, sound range, it sounds very high to them. If the dog barks outside, it sounds very loud to them. Whatever sounds they hear, it sounds extremely louder to them than normal. And a number of them engage in picky eating. So you have to manage their diets and nutrition, try to get them on programs so that they can eat. A number of them do not like to eat, they engage in picky eating. Then there is what we call self-regulation problems with sensory stimulation. So they fail to modulate volume. So for some of them, they cannot control their voice tone. So they sounds low. When they make sounds, the sounds are extremely loud. And then they can also seek inappropriate sensory stimulation. So I move on now to hypotonia. And what is that? This is when they have low muscle tone, fine motor skills deficit, gross motor skills deficit. So when they have deficit in these areas, as parents and guardians and caregivers that they will need a lot of interventions to help them to develop fine and gross motor skills. Now, treatment. What are some of the treatments for children diagnosed with autism spectrum disorder? First, I want to talk a little bit about applied behavior analysis, or ABA. And what ABA does, it encourages positive behaviors and discourages negative behaviors. and improve a variety of skills through the use of positive reinforcement and other ABA techniques such as discrete trial training, verbal behavior training, chaining and shaping procedures to develop different and varying skills for the child. And what happened with the use of ABA is that the child's progress is tracked and measured. So what will happen is that an ABA specialist will probably go to the child's school or the child's home, observe the behavior that is of concern to the parent or the educator. They will take baseline data, and from the baseline data, they will develop an intervention that will best suit the child's need so that the child can develop and function within their deficit. Then we move on to assistive technology. Now, technology is the use of devices such as communication boards, like the picture exchange system, we call that PEX, and electronic tablets with other systems on it that can help with communication and interaction with others. And then we have occupational therapy. And occupational therapy, the child learns skills for independent living, such as dressing, eating, bathing, and relating to people. And then we have speech therapy, of course, and the speech therapy will help to improve the child's communication skills. And with speech therapy, there's also the use of picture boards, or what we call PECs, picture exchange systems. And so I want to share with us today that there are no medications that can cure autism spectrum disorder or treat the core symptoms. What are the core symptoms again? Not lack of lacking in social interaction, um, repetitive behaviors. There are no medications that can cure those core symptoms that are given in the DSM-5. However, there are medications that can help some persons with ASD function better to help manage like high energy levels. So if they have challenges with the energy level, you can kind of give them medication to calm them. It can help with their inability to focus. It can help with anxiety and depression, behavior reactivity, and self-injurious behaviors or seizures. There are medications that can be given to a child or a person diagnosed with ASD to help them manage those kinds of um, levels of behaviors, like the energy levels, the anxiety and depression, and self-injurious behavior and seizures. Please also know that a child can receive a diagnosis of autism spectrum disorder from the age of 18 months to 5 years. So they can receive a diagnosis of autism spectrum disorder. For the month of April, I encourage us to be aware and keep aware of what is involved in autism spectrum disorder so that we can educate others on this disorder, and so that we are able to be sensitive to parents of children who are diagnosed with autism spectrum disorder, and even the child or the children themselves who are diagnosed with autism spectrum disorder. Please remember to like, share, and click that notification bell, and most importantly, to subscribe.